I'm Eva Alisic, and I am an associate professor, child trauma and recovery at the University of Melbourne. I do research on how children and families cope with traumatic events. And traumatic events are, for example, car crashes, children exposed to war, children exposed to violence, children exposed to disasters. So I'm based in Australia. One of the disaster risks is really bushfires. Those are topics that I look at. How children cope with traumatic events, how they recover, what kind of experiences they have in that recovery, so how they feel, what symptoms they might have, and how they feel that they get better over time. And if they don't get better, what is causing that?
What kind of methods do you use to research on this?
So the research that I do and the methods that I use are a mix, actually. So we do interviews with children, with families, with parents, with professionals who work with the children. So for example, nurses and physicians in hospitals. And we also do, for example, systematic literature reviews. We do a project where we use audio sampling. So we take iPods that audio sample children's lives after a traumatic event. So we use a range of methods, actually. Also questionnaires, it's a mix. And because of using that mix, we get a really good insight from various angles on what it is that is traumatic stress and recovery from trauma.
What is traumatic stress and how does a child experience it?
Yeah. So traumatic stress, in particular for children and also for adults, is when something horrible happens, when the world is really turned upside down, that causes a number of symptoms potentially. So for example, for children, that could be that they have to think about it all the time, that they dream about it, or that they have other unrelated nightmares, but they're upset during the night as well. It may be that they avoid certain things. So for example, a child who's had an accident on the street might not want to cycle again. Children may also become more what we call hyper-aroused. So when there's a loud sound, they might have this startle reflex. Those are some of the symptoms that we see. And many people, adults and children, shortly after something bad happens, they will feel bad for a while. Sometimes for a few weeks, sometimes for a few months, but then it kind of turns slowly, it gets better. And so it's important, I think, to know that most children and most adults are very resilient. But also, when something horrible happens, it is normal to feel bad. Yeah.
Are there differences between children and adults?
So there are differences between children and adults. For example, children have less of a framework of how the world works. So sometimes they might interpret something that an adult is afraid of, not so as a threat, so that might be in your advantage as a child, but sometimes it might be the opposite. So for example, if a child has a sibling and they have a big argument in the morning and said, "I wish you're dead," and then the next afternoon that sibling has a car crash, the child might think they are responsible, even though we would know, of course, that's not the case. So children may interpret things differently. They may sometimes also respond differently. So children integrate what happened in their play, for example. That's, of course, a child-specific symptom. And there are also parallels with adults. Adults may also do, for example, avoidance of things that remind them of what happened.
What kind of help does a child need in this context?
So children are very resilient and adults are very resilient. So in most cases, they initially feel bad. They might be sad, they might have those bad dreams or trouble concentrating in school. But gradually, after a few weeks, say 4 to 6 weeks, they start feeling better. They won't all of a sudden be all happy and cheerful again, maybe, or once in a while they may, and it may be fluctuating a bit, but there is improvement. And if at that point, after a couple of weeks, there's no improvement at all, we know that it's unlikely to change then without some mental health support. So most children don't need mental health support. But a few children where that is stable after a number of weeks, there's no change, then we would need, for example, to talk with a psychologist and see, can we provide therapy for the children? Because we know that there are effective therapies for both children and for adults after trauma.
How did you get into this topic?
I'm working in this field because I'm so interested in children's resilience and this fact that we can support children to be resilient. I worked at the child helpline when I was doing my psychology studies, and I was really touched very much by the things that some of the children went through, horrible divorces and maltreatment sometimes, and shocking things. And at the same time, children are resourceful and resilient, and sometimes they do need a lot of help. Sometimes they, it's not always that they will bounce back. And it just really touched me, and I felt that this is something that really matters. This is something where if we can improve our support for children, then that's something I want to contribute to.
What makes a child resilient or more resilient?
That is a good question. We haven't got the answer yet. There's a few things that we think make a difference. And some of them are very logical. A child who has grown up in a warm, loving family with a stable environment has good resources in a way to recover. A child who has been exposed to multiple traumatic events previously is at a disadvantage when a next one happens. So it's more likely to then cause trouble. The same with a child who has exactly those environment factors not in place. So when there are problems in the family, where there is a lot of discrimination around them, where the family itself is maybe fragmented, or there are mental health problems already within the family, or the child has had mental health problems, those seem to make a difference in a negative way. On the other hand, if a child has a lot of social support around them, even not within the family, but outside of that, for example, a teacher who is very supportive, that does make a difference.
You mentioned teachers. How can they, for example, notice when a child needs help?
Yes, often we think of children who act out as that there is a problem, and there may be a problem, but there are also children who are much quieter, maybe a bit withdrawn, and we don't know that there is a problem. So it's important to know that children respond in really various ways. And we talk about this a lot with people in the emergency department, for example, that it's not only the children who are visibly scared or upset who might later on develop traumatic stress symptoms. It can also be children who are very well behaved, if you want to say it that way, who are compliant and who just look like they are fine, but later on they may still struggle. So it's very hard to predict based on their initial reactions how that will progress over time.
And it is of course normal, if you want, that we react when something happens, right?
Yeah. What is normal? It's difficult to answer that question. In a way, the way we see it in my field is it is normal to have bad days and to feel bad and to be very upset when something major happens. So I'm looking into traumatic events which are defined in our field as somewhere where your life was in danger or where your physical integrity was in danger. And of course, it is normal to be upset about that. Then over time, the majority of people will recover from that naturally. They don't need any intervention. But a small number does need some extra support. And all of that, in a way, in my view, is normal. There is not abnormality about it, but it's the events that are not normal.
What are you working on right now?
So one of the things that we're looking at the moment is a very specific type of trauma, is when children are bereaved because the one parent has killed the other parent. So it's extreme domestic violence. And those children, of course, have been through something horrific. Often they have had a long history of domestic violence leading up to that fatal moment. And also they come into a situation that is unique in many ways, that all of a sudden both parents are no longer there and the home is no longer their home. Often that is actually the crime scene and they can't live there anymore. So one of the things that we're trying to do is to better understand from young people who have been in that situation what the support is that they need and how we can support the caregivers of these children. Often that's the grandparents, but not always. And how we can support the professionals working with these young people. So, for example, child protection, but also people, the teachers in school, how to provide a support system for these children. And there are lots of difficulties, of course, in that system. So child protection has a lot of turnover of staff. So that means that for these children, they often have to tell their story again and again and again, because there's a new staff member who needs to know what they have been through. And that is not therapeutic, that's not the aim is to gather information. So we're trying to find ways in which we can really improve our policies there, locally and nationally, to provide a better system of support for these children. And the way we do some of that work is by doing interviews, by looking at case files of these children, so their dossiers in a way, and talking with all these different stakeholders with the aim of really improving our practice.
What these children have to accept and survive is terrible. I cannot imagine how hard it is.
What I see with some of the young people that we talk with is that I am sometimes surprised by how well they are still functioning. Some of them are doing well in school, or have grown up and are in their 20s now and have established their own families and good life environment for themselves. But there's no denying that these are some of the most affected people, of course. And I'm working with a young woman. Her father has killed her mother. And she has had therapy and worked through it and is now doing a social work degree. And she's incredibly eloquent about what happened in her life and how she found out actually fairly late that the reason why her mother was not there was because her father had killed her mother. And that's something we see more often, that the children actually don't always get informed about what has happened, but they feel that something has happened. And many children do struggle as well. I've also met children who were hurting themselves or who felt that they should never marry because there is a risk that they would not survive.
What can be done? What needs to be done?
There is no easy solution. Of course, there is not something that we can quickly do to change it. One aspect of it, of course, is addressing this major topic of domestic violence. And the other is, in the knowledge that we won't have addressed domestic violence quickly, how do we really support these children in these situations? And I think part of that is that for the professionals working with the children, that's very stressful for them as well. So all of a sudden, they have to deal with a child whose both parents are no longer there, one has killed the other, And a professional has to make life-changing decisions about where the child is going to live, whether they get to see the parent in prison if that parent has survived, the perpetrator, should they have any contact with them or not, is that healthy or not, how should the two families, often two family sides are in conflict with each other, how should they communicate? So I feel that if we can take also a little bit of the stress off for the professionals, that may mean that they don't feel under so much pressure, because it's hard if you've never dealt with such a case, such a story in your professional life before. It's enormously difficult. So what I hope that our research will do is provide at least a checklist of things to think about. For example, have we looked at how the two families are in contact with each other? Is there a conflict there? Can we do some mediation? What do we know about the school of the children? Can we support the teacher there? Really practical things like that, but informed by the research.
We need probably to start at least speaking more about this topic, right?
Yeah, unfortunately, domestic violence is a much bigger problem than we would hope it is. And domestic homicide, we know that more than 1/3 of all the women who get killed in the world are killed by an intimate partner or an ex-intimate partner. And in Australia, where I'm based currently, it's approximately every week that a woman gets killed. So it's more frequent than we would want. Of course, it is a slice of a much bigger problem of domestic violence, of violence in general, that we really need to address.
If we generalize, is there a support or therapy that is particularly good in this context?
So in my opinion, well, overall, when children are exposed to trauma, we know that most children are resilient and recover. I feel that this is such an overwhelming event that we should probably provide mental health support to all children who are bereaved by domestic homicide. We know that there are a number of different therapies that are effective for children exposed to either trauma or grief or bereavement and traumatic bereavement. So there are therapies in that space that use cognitive behavioral therapy elements. There is EMDR, where they make movements with a hand while you think about what happened. And there are no quick fixes there. It needs probably substantial support with regard also to how a child has grown up and the attachment that they have developed. So that needs very extensive diagnostic assessment and then a good plan in terms of therapy. But there are therapeutic modules and methods that I think are very applicable for these children.
And I can imagine that the support that these children receive or do not receive has a lasting impact, hasn't it?
So if we get this right, if we improve our support system and we manage to find a therapy that really addresses all the issues and a child does get better, then that has an effect for the rest of their lives. So that's one of the reasons why I work with children exposed to trauma, because I feel that if we, in those early years, if we can get it right, that helps them on a path to having a good life later on. And so there's a lot at stake. We know that if trauma is cumulative, if children have multiple traumatic events, that it gets a higher, they are more at risk to get the next one and to have more mental health problems later on. Inversely, if we manage to change that trajectory with them, then we set them up for much more success. And success meaning being well in the rest of their life.
And the big question, of course, how can we build a less violent society?
So it does relate to our society. If we manage to support our children, make sure that our children grow up in healthy and safe environments, that means that they are on a trajectory that is linked to well-being later in life as well. And the risks of developing more and more violence because we kind of get into a cycle of violence, that is something that if we intervene as a prevention very early on, and we make sure that we set up children for a good life, that it has all these follow-on effects for our whole community and whole society.
If you could change one thing tomorrow, what would it be?
If I could change one thing tomorrow, it would be that we ask the children much more often, as a standard, what is important for them. And that we have that inform how we do our practice, how we make our policies regarding mental health and interventions, and how we interact with children, so that we give them much more of a voice as of tomorrow.
Do you think that we forget to ask our children what is important to them, and we often think that we already know what it is?
Yes, I do think that we do that in many different ways. I see it with other groups as well. Dominant voices get to make decisions or inform our daily life, well, logically, more than the not dominant voices. And children don't necessarily always get that voice. And I think it's very important, if we want to be responsive to what they need and want and where their opportunities are. As you can see now with climate change and children taking the lead in certain ways, in putting that really on the agenda, and young people doing that. That's something that we really need to pay attention to.
Do you have a favorite children's book?
Yes, I do have one. A Dutch writer, Thea Beckman, she wrote a trilogy, 3 books. She writes about a time in the future where there is a big island where people live peacefully in close connection with nature. And it is about young people shaping society there in a very engaging way. So I always love that book for the vision of close connection to nature and other people.
Do you have a dream related to your work?
A really inclusive society. So if I think of my research, most of what we know about children exposed to trauma is from high-income Western countries, and from children who are probably more often in slightly privileged situations. I'm thinking of some of my research where the people who have the means to do one additional thing are participating in research. It's important that we look at all people, and research is part of that in a way that, and also that we do that together, so that children, young people, families co-design the research with us, and that we listen to what is important to them in that research, that we make sure that we are not continuing certain practices that are excluding people. So I know in some of my research, for example, we have a lot less diversity in terms of ethnicity than we have in the general population. That's a problem. And we try and be as inclusive as we can, but partly that has to do because we recruit through the clinical system, and our clinical system is not well tailored to people with a diverse background. We have a very specific paradigm through which we provide interventions. For example, most of the time we give therapy, but in office hours. So that means that those families that can't afford childcare, to have the siblings taken care of while having therapy, for example, they can't really participate in that. So, and all of that trickles through. So, long story to say that if we can be more inclusive, I think that will make a huge difference in a positive way.
What is the most important lesson that you have learned?
Yeah, for me, it's every time when I'm in contact with young people and children and see how they manage, Every time again, I'm impressed and I'm also touched, and I feel like this is so important. We need to get this right.
Thank you so much, Eva.